Hello, everyone. Have you ever thought that a heart attack or stroke could originate from somewhere as unexpected as your own teeth? It may sound unbelievable, but a growing body of medical research shows that chronic inflammation, especially from root canal-treated teeth, could contribute to blocked arteries and even increase your risk of heart attacks or dangerous blood clots in the brain. Today, we're diving deep into a hidden source of heart disease that is often missed in routine checkups. I'm sharing this not just because of what I've studied, but because I've lived it. So if you've been dealing with unexplained fatigue, mysterious inflammation, or vague symptoms that never quite make sense, what if the real answer lies in a silent dental infection linked to heart attack risk? Evidence also shows these microbes are also found in the clots of some stroke victims.
Before we continue, I want to share a true story with you. Linda, 68, lives in a quiet town in Oregon. She loves gardening and listens to her favorite local radio show every morning. But over the past year, something changed. She began feeling constantly tired. Her knees ached, she felt lightheaded at times, and walking across the room became unusually hard. She went through heart tests, blood work, and even neurological checks. Everything came back almost normal. Doctors told her it was probably just aging. But deep down, Linda knew something wasn't right. Then, during a routine dental visit, a 3D imaging scan revealed a dark shadow near one of her molars, an old root canal tooth from nearly a decade ago. No pain, no swelling, but a chronic infection was silently eating away at her jawbone. A few weeks after she had the infected tooth removed, everything started to shift. Her mind felt clearer, her energy returned, and the unexplained fatigue simply vanished. Her story is not rare. And if you're experiencing similar symptoms, maybe it's time to look in a direction no one has suggested yet.
Let me quickly share a personal story. A while ago, I went to the dentist for a routine checkup. They had a very cool device called a 3D cone beam imaging system, which can scan all the tooth roots and look deep inside for potential signs of hidden infections. When I looked at my scan, I noticed a huge dark little circle around one of my tooth roots. The dentist confirmed it was an infection, an abscess under the tooth, eating away at my bone, even though I had no symptoms at all at the time. And what's telling is, from the many comments I've received from you, I know my story isn't unique. Many of us have been or are currently experiencing health issues without finding a cause, until a hidden oral infection is discovered. According to medical experts studying this issue, these chronic, long-term infections can become serious problems, not just for cardiovascular health, but also for arthritis and many other issues. This condition, called chronic apical periodontitis, often has no obvious symptoms. When you chew, bacteria from the infection can be pushed deeper into the lymphatic system in your jaw and spread throughout the body. Data suggests that millions of people undergo root canal treatment each year. A widely discussed theory is that the root canal itself is where the problem lies. During a root canal, the dentist tries to remove the pulp, disinfect, and then seal the tooth. But the problem is, it's nearly impossible to completely eliminate all pathogens from miles of microscopic dentinal tubules. At the same time, this procedure also removes part of the tooth's local immune system. This explains why the incidence of dental abscesses and chronic inflammation in root canal-treated teeth is so high. And more worryingly, many of these individuals also experience heart problems. Sometimes, these infections are missed on routine dental X-rays, and only more advanced imaging technologies like cone beam CT scans can clearly detect them. Many of you have shared that you've suffered from symptoms like prolonged fatigue, systemic inflammation, joint pain, even brain fog or neurological issues without an explanation until a dental infection was addressed. One way to detect inflammation in the body is through a blood test for C-reactive protein, or CRP, a biomarker for inflammation. This infection can be in the tooth, gums, deep in the jawbone, or even in the tonsils. It's the chronic exposure to these pathogens that creates the problem, especially if your immune system isn't strong enough. They cause a state of oxidative stress, meaning the body has too much free radical damage and not enough antioxidants to neutralize it. Just think, our mouths harbor over 500 different strains of bacteria, viruses, and fungi. Toxins from these bacteria can trigger strong immune responses and inflammation in various parts of the body.
One of the body's reactions to this chronic inflammation is the formation of blood clots, which is the direct link to the risk of heart attacks and strokes. So, if you feel tired, your immune system is compromised, and you suspect you have an oxidative stress overload, what can you do? One suggestion is to try taking about 1 to 2 grams of liposomal vitamin C daily. This isn't the usual vitamin C for deficiency. We use it as a potent antioxidant to reduce oxidative stress. This type of vitamin C is special because it can penetrate intracellularly. I recommend taking about 500 milligrams several times a day because vitamin C is water-soluble and you want to maintain a steady level. Another advantage is that it doesn't cause diarrhea like other high-dose vitamin C forms. However, it's crucial to clarify that liposomal vitamin C is a supportive measure to reduce oxidative stress and help the body cope better with inflammation. It's not a direct treatment for the root cause, which is the dental infection or heart disease. If you see an improvement in symptoms, it's a good sign to delve deeper into the cause, which could be diet, lack of sleep, overexercising, or indeed a hidden tooth infection. Now, let's talk about the options when you discover an infected tooth, especially a root canal tooth that's still problematic. This is a difficult decision and needs careful consideration with professional advice. Why is keeping an infected tooth dangerous? As mentioned, completely eliminating bacteria from the complex root canal system is extremely difficult. Even if a root canal treatment seems successful initially, bacteria can persist and cause a chronic, low-grade infection, releasing toxins into the body for years. When should you consider extraction? If a root canal tooth still causes pain, shows signs of recurrent infection on scans, especially cone beam CT, or if you have unexplained systemic symptoms suspected to be related to that tooth, extraction might be a worthy consideration. Many people have shared that their health significantly improved after removing these problematic dead teeth. Restoration options after extraction. Dental implants. This is a common solution, but material choice is important. Zirconia implants, which is a type of ceramic, are being considered a more biocompatible option than traditional titanium for some sensitive individuals. However, implants can be costly. Bridges require grinding down adjacent teeth for support, which can affect these healthy teeth. Removable dentures, a less expensive option, but can be inconvenient for daily life. Each option has its pros and cons, and you need to discuss thoroughly with your dentist to find the most suitable solution for your situation and budget.
How to find the right dentist. Look for dentists with a holistic approach, or those who understand the connection between oral health and overall systemic health. Don't hesitate to ask about their experience in handling chronic dental infections and the materials they use. A major issue that many of you also mentioned in the comments is the cost of dental care and the fact that dentistry is often separate from the general healthcare system. This is indeed a significant barrier preventing many people from accessing necessary treatments. We need systemic changes to give dental care the importance it deserves and make it more accessible to everyone, because clearly, oral health is an inseparable part of overall health. So what can we do to prevent these problems? Proper oral hygiene. Brush at least twice a day, floss daily, and use an appropriate mouthwash. Healthy diet. Limit sugar and processed foods that can cause inflammation and allow bacteria to thrive. Increase intake of vegetables, fruits, and nutrient-rich foods. Regular dental checkups. Don't wait until there's a problem. Professional cleanings and checkups every 6 months help detect potential issues early. Careful treatment choices. If a root canal is recommended, do your research.
get a second opinion if necessary, and choose an experienced dentist who uses modern technology. This is just a brief overview of a very complex and important topic. I highly recommend you seek further information from reliable medical sources for more detailed data. If you have personal experiences related to this topic, feel free to share them in the comments if you're comfortable. But please keep your story brief and avoid sharing personal medical details. However, remember these are personal anecdotes and cannot replace professional medical advice. Finally, once again, I want to emphasize, the information in this video is for reference purposes only, intended to share knowledge and raise awareness. It does not substitute for professional medical diagnosis, advice, or treatment. Always consult with a qualified doctor or dentist regarding any health concerns you may have. Thank you for watching.